Story 1. Not an oncologist, but I am a radiation therapist, so I treat cancer patients every day. There are lifestyle habits you should avoid because they are linked to certain cancers or considered risk factors associated with certain cancers. One hard truth I have learned in my years of doing this job is that cancer really does not discriminate. If it comes for you, it comes for you. I have treated 11-month-old babies with brain tumors, a woman who never smoked a cigarette or had a drink in her life and did not have the breast cancer gene and got cancer in not one but both breasts 11 years apart. Both primary tumors and not related to each other, triathletes with leukemia. It is an evil and unfair disease. Now I am in a specialized field where I only treat skin cancers with a superficial treatment machine, so I see less death and despair. My best piece of advice is wear sunscreen and get your moles and spots checked. Health insurance typically covers a yearly total skin check at a dermatologist. Story 2, oncology nurse here. I would never skip recommended cancer screenings, and I would never ignore unusual unexplained symptoms such as sudden weight loss, blood in stool, ongoing abdominal pain, excessive bleeding or bruising, unusual skin lesions, or swollen lymph nodes not related to acute illness. It is heartbreaking when people ignore symptoms and do not get diagnosed until the cancer is too advanced for treatment to be effective. Also, I am a strong advocate for sunscreen. Surgeries to remove skin cancer can cause significant damage to your face. Story 3. Tobacco, never. Alcohol, ideally never, but I consume it only lightly. Screenings, never skip one when it is recommended. All this to say, I still got breast cancer at the age of 36, so sometimes you just cannot do much about bad luck. Story 4. Reading all this, I am surprised I have made it this far. Maybe I should start riding a motorcycle to increase my chances of not dying from cancer. Story 5. Cancer biologist with over 20 years of experience. Avoid all tobacco. Do not skip screenings. Limit alcohol consumption. Try your best to control your weight. Use as little plastic as possible for food storage and drinkware. Glass is best. Never put plastic in the microwave. Story 6. Please do not say coffee. Story 7. Bone marrow transplant hematology and oncology specialist here. Do not smoke. It does not matter what it is, no smoking. Also, increase your fiber intake, avoid areca and betel nuts, and get the human papillomavirus vaccine. The 9-valent vaccine is now available up to age 45. Story 8. This is less about what one can do for oneself and more about being aware that, along with chance, genetics, smoking, and alcohol, a difficult childhood with adverse experiences can also significantly increase the risk of cancer. A child may have been in a difficult home, do everything right, and still develop cancer because their caretakers did not provide the necessary care. Story 9. Former fellow of the National Cancer Institute here. I hate to tell you this, but it is alcohol. It directly causes at least 7 kinds of cancer. 20 years from now, we will talk about alcohol the way we talk about cigarettes today. Story 10. Hematopathologist here. I never use herbicides or weed treatments on my lawn. I have seen too many cases of childhood leukemias and lymphomas, especially in children of parents who work in lawn care. I also do not smoke or drink alcohol. Story 11. Oncologist here. Do not smoke. Maintain a healthy weight. Eat and drink what you want within this framework. Alcohol in moderation is fine. Cancer is partly genetic, partly due to exposure, and mostly due to age and bad luck. Story 12. I am an oncology nurse, and I make sure never to heat anything in plastic. I also avoid buying drinks in plastic containers. I consume alcohol only once or twice a year. I use sunscreen daily and engage in daily physical activity without fail. Story 13. Not an oncologist but a hospice nurse. End-stage alcoholic liver disease is the most horrifying way to go. Doing what I do has completely changed my relationship with alcohol. Story 14. Why do doctors keep recommending mammograms for women with dense breast tissue? Mammograms cannot detect cancer in dense tissue until it is too late. Why are they not using magnetic resonance imaging and ultrasounds instead, which can detect cancer earlier in dense tissue? My wife just found this out the hard way. She was shocked to learn that she was getting the wrong kind of scan every year. Now it is probably too late for her. Story 15. Cancer researcher here. You can do everything right and still get cancer. You can do everything wrong, smoke, drink, be overweight, etc., and not get cancer. It is bad luck and genetics. Story 16. Cancer nurse here. If you experience any unusual symptoms such as lethargy, swollen glands, pain, weight loss, night sweats, or a persistent cough, get a simple blood test. If you are bloated, have abdominal or back pain, changes in urine color, persistent headaches, or changes in breathing, get an X-ray, computed tomography, or ultrasound. If your general practitioner dismisses you and does not investigate at all, find a different general practitioner. Many patients diagnosed late have usually visited their general practitioner several times without any tests performed. You cannot always prevent cancer, but you can certainly catch it early and improve your chances of beating it. Story 17. My best friend's mother is a breast cancer specialist who previously worked in the emergency room. She says the number one behavior she warns against is riding motorcycles because of the many gruesome deaths. You can fight cancer, but you cannot scrape that body back off the ground or reattach heads. Also, smoking is harmful. Story 18. Vaping is concerning because we do not know if it causes cancer. When I quit smoking, everyone encouraged me to switch to vaping, but I declined. I was not interested in being a test subject for this technology, which may eventually be found to cause multiple types of cancer. Story 19. I will always make sure my nieces and nephews are well protected in the sun. Sunburn, especially in childhood, significantly increases the risk of melanoma. I also remind my other family members about good sun protection, as prolonged sun exposure increases the risk of non-melanoma skin cancers. Wear your sunscreen and do not use sunbeds. Story 20. I work in pathology, meaning I am a doctor who uses a microscope to examine abnormal cells taken from patients and order molecular-based or immunology-based workups, such as immunohistochemistry, for identification and prognostication. At one point, I have seen cancers linked to years of smoking and alcohol use. I have seen cases of colon and cervical cancers in people who neglected their screenings. I have seen patients with more risk factors than a criminal record have a mildly dysplastic growth on their anatomical part and live perfectly normally afterward. On the other hand, similar to many people who have commented here, there has been a rise in the number of patients with late-stage breast, cervical, ovarian, lung, stomach, kidney, and other cancers who have few, if any, risk factors. The cause of this increase remains unknown. Whoever discovers why more Generation Zers and millennials are getting cancer at much higher incidence rates than baby boomers will win a Nobel Prize. In essence, reduce or eliminate harmful habits like smoking and drinking, exercise regularly, and eat fiber. But do not see these actions as guarantees against cancer. No one is too young to get cancer. The youngest colorectal cancer case I saw was in their early 20s. Reporting symptoms to a doctor who genuinely cares is important. Too many old-school baby boomer doctors ignore symptoms despite a massive rise in low-grade appendiceal mucinous neoplasms, aggressive ovarian cancers, and diffuse gastric adenocarcinomas in this country. Additionally, targeted therapy and immunotherapy, along with targeted radiation and new chemotherapy protocols for leukemias and solid tumors, have grown exponentially, mainly due to advances in molecular characterization. Just 2 months ago, we began testing for a specific molecule common in gastrointestinal cancers that, if present in a patient's tumor, makes them eligible for a newly developed targeted therapy option. Story 21. My sister-in-law has always been extremely healthy. Her degree is in nutrition. She is very active, has never smoked, and rarely drank. She is 58 years old and has terminal breast cancer. Story 22. Yeah, it is a gamble. 20-year smoker, heavy and light drinking for 45 years, various drugs and physical recklessness for 10 years, very bad diet for over 30 years, 60 and cancer-free. My sister has never smoked or done drugs, is a light drinker, has a decent diet and exercises. She had cancer at 55. I will say that while being currently cancer-free is great, there are plenty of reasons to take better care of yourself than I have. Being cancer-free at 60 is great, but not so great when you feel closer to 80 half the time. Story 23. Not an oncologist, but my late father was. Don't smoke, don't drink alcohol, don't be overweight, wear sunscreen, and minimize eating pork. Eat fibrous vegetables and foods containing turmeric. Don't hesitate to advocate for yourself when using health professionals. If they are deciding whether to treat gently or radically, always opt for radical treatment because one day you will need radical surgery anyway, and by then you will be less likely to fully recover. One other thing he swore by was having a social life because happy and supported patients last longer, even when terminal. My father died at age 80 of the irony, a rare cancer with a genetic link, so my advice is always to keep your medical screening appointments with your general practitioner. Story 24. It has already been said many times, but I strongly agree, so I will repeat it again. Do not smoke tobacco. Do not drink alcohol. Always get your health screenings, but I feel especially strongly about colonoscopies. Never ignore bloody stools. Story 25. Not an oncologist, but I had an air pollution lecturer once state that he does not eat barbecued food because of the charring and smoke residue carcinogen levels. Story 26. Not an oncologist, but I am an anesthesiologist and perform many anesthetics for these cases. Unexplained weight loss is always concerning, as it may indicate thyroid issues or cancer. Blood in stool or sputum, daily headaches worse in the morning, night sweats, lymphadenopathy, lumps and bumps, and moles that look unusual should be evaluated. Get regular skin cancer checks and screenings. Do not smoke. Limit alcohol consumption. Aim for a healthy weight, although much is genetic. Story 27. As someone who grew up with an oncologist in the family, though they are now retired, I can share the following. They do not eat red meat. They follow a balanced diet of fish, poultry, plenty of fruits and vegetables, and one sweet per day. They take daily vitamins and supplements. They drink alcohol very rarely, only on special occasions and holidays, and limit it to 1 or 2 beers. They do not use tobacco or drugs. They walk daily and lift weights twice a week at 80 years old. They avoid pesticides on the lawn, believing that if it kills one type of vegetation, it will harm innocent creatures and eventually humans. They also wear sunscreen daily with SPF 30. Story 28. Not an oncologist, however, as a doctor, I have to say limit your alcohol consumption and get daily exercise. There is no way to prevent cancer completely, but you can take steps to reduce risk. It is also largely genetic and related to unavoidable exposures. One thing I will add, the better shape you are in when you become ill, the better you will handle the treatment. Story 29. Hematology/oncology nurse practitioner here. Smoking is a big risk factor. I do not smoke and avoid secondhand smoke. I avoid plastic and silicone utensils with hot foods. Alcohol should ideally be avoided, but I consume it in moderation. I am significantly more cautious about alcohol intake since entering this specialty. Red meats are an occasional treat. I also do my best to avoid overly processed foods now. Story 30. My close friend's mother was prescribed mood stabilizers and given psychiatric appointments after experiencing falls, panic attacks, and fainting. When she lost vision in one eye, doctors performed scans and determined that she did not have anxiety. She was dying of eye cancer that had spread to her brain. Story 31. Fiber and antioxidants in the diet. I take a shot of high polyphenol olive oil each day. Use sunscreen and get plenty of exercise. I avoid alcohol except on special occasions. Protect your gut microbiome from unnecessary antibiotics. Healthy bacteria keep the immune system balanced and are linked to improved cancer surveillance. That is what I recommend in my neuro-oncology clinic. Story 32. Oncology genetic counselor here. It's my job to determine if someone's cancer is due to inherited risk and to assess lifestyle risk factors that contribute to diagnosis. Things I would never do. Smoke. Increases risk for lung, breast, pancreatic, colon cancers, and more. Consume alcohol. There is no safe amount. Increases risk for colon, pancreatic, breast cancers, and more. I advise my patients to limit it to weddings and funerals if possible. Use aspartame, found in many diet sodas. May increase risk for colon cancer. Eat too much red meat. No more than 2 servings weekly on average. Increases risk for colon cancer. Controversial, join the armed services in the United States. The number of people who developed cancer due to exposures while serving is significant. Camp Lejeune, asbestos in the Navy, the tar pits, Agent Orange, etc. Always recommended. Keep your primary care provider informed about your family history of cancer, as it may provide access to earlier or enhanced screening. Screenings such as mammograms, colonoscopies, prostate exams, and skin checks. Exercise. 30 minutes of cardiovascular exercise 3 times a week is correlated with a lower breast cancer risk. Maintain a healthy body weight. Excess weight increases risk for uterine, colon, and breast cancer. Consume fiber. Reduces risk of colon cancer. Use sunscreen. Basal cell carcinoma is the most common cancer worldwide. Talk to your doctor if you experience ongoing unexplained symptoms, especially weight loss, fatigue, rectal or unexpected vaginal bleeding, pain, new lumps, bumps, skin lesions, new or changing moles, or ongoing diarrhea or constipation. The 2-week rule can help distinguish random symptoms from those that are more concerning. I tell patients it is probably not cancer, but with your family history, consult your doctor and be sure. My biggest advice: improve your lifestyle and complete recommended screenings to hopefully catch diagnoses early or prevent cancers that are out of our control. Story 33. Everyone talks about tobacco and alcohol, and here I am, a 36-year-old man who has never smoked or drunk alcohol, diagnosed with lymphoma at 34. I caught it early, though, so I think the most important advice is to listen to what your body is telling you and don't be afraid to ask your doctor about it. Story 34. I would say 80% of the non-breast cancers I see are heavily contributed to by smoking, heavy drinking, and excessive sun exposure. The remaining 20% are bad luck without any obvious cause. Get your proper screenings. Colonoscopy and mammogram guidelines have changed to recommend them earlier for the average risk person. Colonoscopies at age 45, mammograms at age 40. I have to tell my friends about this. For some reason, their primary care providers do not seem to keep up with the guidelines. Story 35. Tobacco of any kind. Oropharyngeal cancer, lung cancer, pancreatic cancer, breast cancer, colon cancer, it goes on. It is literally one of the most modifiable risk factors. Smokers are some of the sickest and highest risk patients in medicine. Story 36. It struck me the other week that no one on my oncology care team is overweight. So, answering for them, do not get fat. Story 37. Cancer scientist and epidemiologist with a Doctor of Philosophy degree. Echoing what many have said, tobacco, never. Sunscreen, always. Alcohol, moderation. Less is better. A strong advocate for the human papillomavirus vaccination for both males and females. It prevents many cervical and head and neck cancers. Get recommended screenings. If you have an inherited predisposition, talk to your physician about an alternative screening schedule. Try to move your body and eat nourishing foods. Everything else is debatable. Live your life, and if something feels or looks unusual, get it checked out. Story 38. Oncology nurse. No tobacco, no alcohol, regular exercise, do my best to get enough fiber, and stay as hydrated as possible. Story 39. Something that always surprises my breast cancer patients is when I tell them to avoid vitamins, especially antioxidants, as they could be associated with a higher risk of recurrence and dying from cancer if taken during or before cancer treatment. There is much information about this issue with contradictory results, but until we get better evidence, it is logical to be cautious about vitamins. Here is one of the articles I base my recommendation on. Story 40. Never skip your colonoscopy. I am under the age limit for regular screening colonoscopies, but would get one immediately if I could get my insurance to approve it. Story 41. I see many patients who do not drink or smoke and do not have any risk factors, including genetic risk factors, yet end up with cancer. I believe that, over time, we will have more evidence that cancer is caused by some form of environmental exposure caused by humans. I also believe regulation plays a role in preventing these occurrences. I have practiced throughout this country, and I am convinced that cancer is worse in states with predominantly conservative policies. and that this can only partly be explained by poverty and lack of access to healthcare. Story 42. According to a friend who works as an oncologist, I will never smoke, always wear sunscreen, and never microwave anything in plastic. That stayed with me. Story 43. All of you in here trying to extend your life, have you not had a good look at how the world is now? Eat the cake, drink the wine, enjoy the bacon. We are all going to die anyway, so why not enjoy the few things available to us? My mother never smoked or drank, ate healthier, and exercised more than any elderly person I knew. Yet she died of throat, mouth, and head cancer a couple of years ago at the age of 76. My father drinks heavily and smoked for 25 years, and at 78, he is still active with minor health issues. It is the luck of the draw, in my opinion. Story 44. I was diagnosed with stage 2 breast cancer at 31 years old. Then I had it again at 50. I avoid nothing except tobacco and alcohol. Life is short, and I will eat, drink, and be merry. It is not for everyone, but I want to be happy with the time I have left. Story 45. From what I have seen, the consensus seems to be: do not go in the sun, do not eat meat, do not smoke, do not eat smoked foods, avoid hot foods, do not eat cold cuts, do not drink alcohol, coffee, or caffeine, do not eat sugar, do not wear bras, do not wear tight underwear, and avoid having cancer in your family history. Has anyone mentioned water yet? Story 46. I am not a doctor. However, I have met people who never consumed alcohol, tobacco, or coffee, and they still died young from cancer. The point is, you can do everything right and still die. I am not saying that you should smoke or drink excessively, but it is important to have perspective. Story 47. Koi pla is a traditional dish from Thailand made with raw fish. It is important to be aware that consuming this dish can pose health risks, including liver cancer and parasitic infections. Proper preparation and thorough understanding of the potential dangers are essential for those who wish to try koi pla. Story 48. Registered nurse breast cancer survivor. Avoid cigarettes. There is no safe amount of alcohol for cancer. Obesity increases the risk of cancer and heart disease. It is especially bad for breast cancer. A sedentary lifestyle increases risk. Avoid sugar, nitrates in lunch meats, pork, and grilled meat. Avoid processed foods. Avoid plastics, especially water bottles. Eat fresh fruits and vegetables. Move your body. Add whole grains and fiber to reduce colon cancer risk specifically. Add fermented foods for gut health, such as yogurt, kefir, and sauerkraut. Drink coffee. Up to 3 cups daily decreases death from all causes, including cancer. Mind-body wellness, such as yoga and meditation, is also helpful. I was shocked to learn that 150 minutes of exercise weekly reduces my breast cancer recurrence risk by 40%. The therapies I'm on only reduce it by 50% and cause many side effects. I knew exercise was good for me, and I have always been active, but I really stepped up my game and now walk 3 to 5 miles 5 days a week. Story 49. Avoid processed foods, tobacco, alcohol, red meat, and excessive stress. Be sure to exercise and get a consistent 7 to 8 hours of sleep. Story 50. I am not a doctor, but I got a rare, deadly cancer at 33 with no risk factors. It is most common in men over 65 who have poor lifestyles and heavy drinking, but I am a young woman. You can do everything right and still get cancer, but of course it is best to live a healthy lifestyle and avoid known carcinogens. Story 51. Not necessarily an oncologist, but a biologist who has conducted cancer research at various points in my career. I try to only pay attention to the risks in activities I perform repeatedly over many years. One-time asbestos exposure or occasional inhalation of fumes does not worry me, but I am more careful about things that are part of my daily routine. Story 52. Is grilling really that bad for you? Once a week, we grill chicken and eat it all week. I am not boiling chicken. Story 53. My dad's oncologist told me that smoked meats are carcinogenic. My dad had bacon every day for his whole life. He also ate kielbasa and cold cuts, all preserved with nitrites. The doctor said that because my dad died of stomach cancer, I should never eat bacon or any other preserved meat. Story 54. I avoid electronic cigarettes and vapor products. The long-term effects are still unfolding, but early data is troubling. Story 55. I'm not an oncologist, but my mother worked as an oncology nurse. The number of people who receive news that they have cancer and think about it for a year or two is mind-blowing. They need to accept the news before starting treatment, often when it is far too late. Sometimes they arrive by ambulance, actively dying, and say, "You are doctors, cure me. Why do you do nothing?" They do not want to go home or to hospice. They want to stay in hospital care. The people who are healthy after starting treatment at stage 1 is over 90%. For some cancers, it is close to 100%. Story 56. Definitely echoing the above sentiments. Avoidance of tobacco is an absolute must. Alcohol should ideally be completely avoided, but if not, limit it drastically. Regular screenings are essential. Also, do not ignore any unusual symptoms, such as unaccounted weight loss, bloody stools, persistent abdominal pain, abnormal bruises or bleeding, unusual skin lesions, or unexplained swollen lymph nodes. It is very difficult to see people not take these signs seriously and then face a late-stage diagnosis when treatment options are much more limited. Additionally, apply sunscreen generously. Skin cancer can cause serious damage. Despite following all these preventive measures, sometimes it is simply a matter of unfortunate luck. I was diagnosed with breast cancer at 36 myself. Remember, alcohol has been directly linked to at least 7 types of cancer. In a few decades, society may view alcohol as negatively as cigarettes today. Story 57. With that, how do you oncologists feel about intermittent fasting? My understanding is that it destroys abnormal cells as your body is detaching from nutrition before switching into ketosis. Story 58. This is a humorous question. My cancer specialist laughs at me when I bring up how I eat for my health. Well, not laughs exactly, but to him, there is no connection. Story 59. A doctor, but not an oncologist. There was a study several years ago about what doctors do and do not do in terms of recommendations. The only consistent finding was that doctors avoided tobacco. That being said, my grandparents smoked heavily. Pneumonia is what killed them. Story 60. I avoid smoked foods and heavily cured meats like salami. I know too many people with stomach or colon cancer. Story 61. Never smoked a day in my life. Rarely ever drank. I run 10 miles a day. Went to my primary care physician because I had severe back pain. It was hurting so badly that one day I couldn't even get up. I have 2 children, so I had to get my father to watch them and my mother to help me get to the doctor. They gave me muscle relaxers. I said I would really like an MRI because something did not feel right. I got an MRI a week later. I was told I had bone cancer that metastasized, and the primary source is from my lung. I now have stage 4 cancer, so just live your life. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.